Section 3 of the PADI Rescue Diver course builds upon and extends what you've learned so far. You'll learn more about developing emergency action plans, what you need to know for developing your underwater emergency skills, and actions to take if a diver's missing. No two emergency situations are identical, so the most effective responses result from teamwork and preparation that adapt the available resources to the situation. It's a way of thinking about what could happen and how you and others might best respond, so you have the information you need in an emergency at a particular location or site. Generally, the plan may consider local hazards, team member roles, and accessing emergency services. Areas of information for the plan may include a general but flexible sequence of steps to follow, emergency phone numbers, and similar information. A script that can help prompt what you say to emergency personnel if needed. And any special procedures or considerations for getting the patient into emergency medical care. Depending on the location and what happened, the action plan may include information about required accident and incident reports. Although it's not always feasible to practice, emergency action plans give you the basis for doing so when you can. Practice runs refine your skills and reduce stress in a real emergency because you're familiar with your roles and what to do. They allow you to evaluate your performance and refine your plan. An emergency action plan doesn't have to be complex. As mentioned before, in developed areas with sophisticated emergency medical response, the plan may be as simple as call EMS, coupled with general rescue skills. Professional dive operations have and maintain emergency action plans, sometimes set up and coordinated by the entire local dive community. In such a setting, in an emergency, your role would likely be as a skilled team member assisting a dive master or instructor. On the other hand, diving in a remote location away from a dive operation might call for a very detailed emergency action plan with multiple emergency contacts and considerations for providing aid for hours before reaching medical care. If you'll be diving in this type of situation, consider additional training in remote area first aid and emergency management. From your emergency first response, CPR, and first aid training, you know that basic life support, BLS, includes monitoring a patient's breathing and circulation, and providing rescue breaths and chest compressions is necessary in an attempt to continue getting oxygen to body tissues. Dive accidents can lead to decompression sickness, lung overexpansion injuries, overheating or overcooling, and drowning. And just as in any sport, people sometimes have heart attacks or strokes while diving. All of these can cause respiratory and cardiac arrest, calling for BLS. Time is critical for someone who needs rescue breathing or CPR. But in diving, it's harder to assess a diver's condition, and while you can give rescue breaths in the water, the victim must be on a firm surface for chest compressions. The realities of diving may keep you from starting BLS as soon as you'd like, but your goal is to do as much as you can as soon as you can without compromising your own safety. For example, you might not be able to do anything about a 10-minute swim to get someone out of the water for CPR, but you might get emergency medical care on the way immediately with a yell or whistle to someone. Primary assessment, as you know, is assessing someone's situation and condition so you can provide the right care with the right priority. Let's see how you would do this in a diving context. First, assess the situation. Look for hazards that may have injured the victim that could hurt you too. Be sure you're safe. Second, shout as you approach, then tap to check responsiveness. Turn a face-down unresponsive diver face up. Third, call for help if the diver doesn't respond. If necessary, use your surface signaling devices to get attention. If necessary, drop the victim's weights to establish ample buoyancy. Then fourth, remove the mask and regulator and open the airway. You'll learn more about techniques for doing this in the water. Fifth, look, listen, and feel for breathing. You'd begin rescue breaths if she weren't. You'll learn different techniques for giving rescue breaths in the water. The sixth primary assessment step is to check for circulation. A victim who's breathing normally may be assumed to have a heartbeat. One who isn't breathing normally, or at all, may be in cardiac arrest, but you can't provide CPR until you're out of the water. With a breathing diver, checking for bleeding is the seventh step. In diving contexts, a responsive diver will be able to tell you where to look. Massive bleeding is obvious in water, but smaller yet serious wounds may not be. Look for slices or gashes in the exposure chute. Water can slow the body's clotting mechanism, but direct pressure and elevation above the surface, if possible, will reduce bleeding. A responsive victim may be able to apply pressure while you tow her to safety. What you can do in the water is limited, so you should be taking steps to get the victim out of the water as quickly as possible. Usually, this means towing her to safety, but sometimes help can come to you faster. Shock management is the final primary assessment. Getting the diver into a safe environment and assuring breathing, circulation, and control of bleeding are initial shock management steps. Continue as you learned in the Emergency First Response course. Shock may be characterized by shallow rapid breathing, clammy skin, weak rapid heartbeat, restlessness and anxiety, and confusion. Shock is possible after injuries specific and not specific to diving. Keep the patient lying down. In some climates, you may have to cut an exposure suit off a weak patient to prevent overheating or overchilling. Cool water, hot climates, and heavy exposure suits create a potential for emergencies caused by both overheating and overcooling. Heat exhaustion and heat stroke result from overheating, usually before a dive, when a diver wears a full wetsuit or dry suit in a hot climate. The suit inhibits the body's normal cooling, and movement makes things worse by generating heat. Heat exhaustion results when conditions tax the body's ability to cool itself. When you notice signs and symptoms like profuse sweating, nausea, dizziness, weakness and faintness, coupled with cool, clammy skin, suspect heat exhaustion. Begin with primary assessment and move the patient somewhere cool and shaded. Then, get him out of the suit. Have him drink water and generally cool off. If symptoms don't subside in half an hour, contact emergency medical care. Heat stroke results when the body's cooling mechanisms fail. The core temperature rises, much like a fever. If the patient feels hot to the touch, has hot, dry skin, and isn't perspiring, suspect heat stroke. Heat stroke is a serious medical emergency. Get the patient into a cool area, remove his exposure suit, and immerse him in cool water or apply cool, wet towels. Contact emergency medical care while providing primary care. The opposite problem is hypothermia, excessive cooling that drops the core temperature below normal. It's associated with prolonged exposure to colder water, but can result from wearing inadequate protection in warmer water, from making multiple dives without rewarming between them, and from cooling at the surface before or after a dive. Even mild hypothermia affects divers. First, the cold distracts the diver's attention from the dive. Second, numbness in extremities, especially the fingers, causes dexterity loss, weakness, and poor coordination. As hypothermia becomes severe, it impedes thinking, slowing emergency responses and affecting good judgment. Hypothermia signs are often hard to see, especially underwater. Besides shivering, they include blueness in the lips, fingers, and toes. With severe hypothermia, the diver becomes weak and confused. Body systems may fail so that shivering stop and divers feel warm, even though he's now cooling even faster. Unchecked, unconsciousness and death follow. Begin with primary assessment. Get a responsive diver with suspected hypothermia into someplace warm. Remove wet garments and insulate him. Keep him lying down and apply heat to the neck, armpits, and groin. For severe hypothermia, contact EMS. Protect the patient from further cooling, but leave rewarming to medical emergency professionals. Improper rewarming can cause further injury. Compared to at the surface, underwater trouble signs can be subtle. But you can sometimes see that something's wrong and panic is likely and imminent. Or trouble may be obvious. Like spitting out the regulator and bolting for the surface. How you help with an underwater problem varies with the problem and circumstances. Overexertion is often caused by fear or trying to swim too hard and linked to stress and feeling air-starved. Have an overexerted diver stop and rest, ideally hanging onto something stationary. Uncontrolled descents can happen if a diver fails to control his buoyancy, is overweighted, or has a problem like a flooded dry suit. Make contact and add air to his BCD, or yours if that doesn't work. But be aware that you're very buoyant if you let go. In extreme cases, you or the diver may have no alternative but to ditch the diver's weights. But this can turn an uncontrolled descent into an uncontrolled ascent. The opposite problem, an underweighted diver, only gets more difficult as the dive progresses as her cylinder gets lighter. Help the diver control her ascent, surface, and correct her weight. Losing weights, a stuck inflator valve on a BCD or dry suit, or improper dry suit techniques can cause a runaway ascent. Make contact and deflate the diver's BCD or dry suit by using the exhaust valve. Or disconnect the inflator hose if that's the problem. If you can't stop or control a runaway ascent, let go and signal the diver to flare out to slow the ascent with drag. Surface at a safe rate if necessary to check on the diver's condition, but don't risk getting hurt too, or you won't be able to help. The most common cramp in diving is in the calf. Help him reach his fin tip so he can pull to stretch the muscle, and gently massage the muscle. After relieving the cramp, it's best to rest a few minutes before moving on again at a slower pace. Entanglement and entrapment can occur, but are relatively rare. In both cases, first have the diver stop everything. Your first concern is to assure the victim has enough air. Assuming adequate air supply, have an entangled diver hold still while you slowly disentangle her. Use a cutting tool with great care only if it's obvious the disentanglement isn't working or will take too long. As you learned in passive panic, a diver freezes almost catatonic, apparently unaware of anything and taking no action to help herself. If you suspect passive panic underwater, take the diver up, holding in her regulator. At the surface, establish buoyancy and help the diver to safety as needed. Be cautious, though. Passive panic can go to active panic without warning. With active panic underwater, your primary concern is to prevent a rapid breath hold ascent. With a breathing, panicked diver, simply slowing the ascent is your best bet for controlling the rate and getting him to breathe. With out-of-air panic, delaying the ascent may be enough to get him to take your alternate air source. Assume that a panicked diver without his regulator is holding his breath. If he won't take your alternate, you may have to push it into his mouth while gently pushing the purge to keep it clear. Even if he begins breathing, the panic diver will likely be choking and coughing and continue to rush to the surface. Flaring out is the easiest way to slow an ascent while trying to control the situation. At the surface, help the victim become buoyant, provide assurance, and help him calm down. Stay close and assess the diver for decompression illness or other problems that could require assistance or emergency medical care. A missing diver is a potentially serious situation. If the diver is underwater and not breathing, time is critical because permanent brain damage can occur quickly. The conservative course is to assume the worst until you can account for him. How you respond depends on the environment and resources you have at hand. When you discover a diver's missing, follow these steps as best you can. Have someone contact emergency assistance as appropriate for your location while you find out where the diver was last seen. Assign people to look for bubbles. Depending upon the situation, you may want to determine if the diver may have left the area without telling anyone. If available, assign qualified diver teams to gear up for a search. If conditions allow, seeing the bottom from the surface, a snorkeling team may be able to enter the water faster to search. Or they can place search markers for the scuba divers. But don't delay the search to make this happen. Start your search where the diver was last seen. Descend without swimming so you drift the same way an unresponsive diver would. Random searching is slower and less effective than a methodical search. There are 4 patterns commonly used to look for missing divers. The first is the U-pattern search, which allows you to cover a large area with only a compass. It's a good choice when you have several search teams covering different parts of a large area. The expanding square is a good choice when you have only one search team. It's effective in moderate visibility and on irregular bottoms, and you only need a compass. It's most useful when you believe the missing diver isn't far from the start point. A circular search allows you to search a large area rapidly in poor visibility. However, it requires a line and reel and doesn't work well when there are many obstructions on the bottom. The surface-led search requires a boat or diver at the surface, a line, and several divers who are familiar with it. It lets you search a large area of relatively shallow water quickly, with the boat or diver at the surface controlling the pattern. These searches work well for missing divers, but you can learn more about searching for lost objects and recovering them in the PADI Search and Recovery Diver course. For more information, ask your instructor. Keep these search considerations in mind. Have a way to recall searchers when someone finds the missing diver. Searchers stay in buddy teams and must have ample gas and no stop time. Don't let searchers jeopardize themselves. Assign someone to track and account for search teams so they don't get forgotten when the victim comes out of the water. If you don't have qualified divers present to search, you may have to choose a buddy and do it yourself. Search until finding the victim, reaching an exposure limit, gas supply or no stop limit, hearing a recall, or 30 minutes. If unsuccessful to this point, discontinue the search and turn it over to the professionals.